Hello and welcome. We're talking tonight about a topic that I haven't done any interviews on for years and years. We're talking about digestive problems and digestive health. And we're going to talk about a book that's just come out called Trust Your Gut. I love the title. It really gets one's attention, doesn't it? I've learned that 40 million people in our country have digestive problems. That's a lot of people. And it's the largest cause then for work absenteeism. So we have a lot of reasons to listen up tonight. My guests are the authors of Trust Your Gut. They're both very well known in the integrative health field. Greg Plotnikoff is my first guest. Welcome, Greg.
Thank you. Great to be here.
You are an internist, a pediatrician. Tell us where you work and where you plug in. You're a busy, busy guy.
Well, I'm at the Payne George Institute for Health and Healing on the Abbott Northwestern campus, and I see a lot of patients with a lot of really challenging issues, including gut issues. And along with Mark, we had to get out word about what people can do for themselves. So I'm thrilled to be here and to be able to share with Mark our message.
Both of my guests have worked directly and indirectly with Andrew Weil, and as most of you know, a very well-known man in the field of integrative health. You have worked with his faculty down in Arizona.
Yes.
This is Mark Weisberg, who is a clinical health psychologist. You're also a pain expert, and tell us all the places you plug in at the university.
Sure, a
your
few
own
places.
pain clinic.
And I just want to mention it's nice to be back here again.
Yes, Mark's been on at least twice.
That's right.
Through the years.
So I consult in a couple of different places. One is I'm one of the co-owners of the Minnesota Head and Neck Pain Clinic, which is an integrative medicine pain clinic. And while we treat full body pain, many of the people there also present comorbidly with digestive disorders, which is how I got interested in the area. I also have a private practice where I see people who have digestive problems and other psychophysiological disorders. And like Greg, I do a fair amount of speaking around the country on topics related to mind-body medicine and integrative health.
How did you two hook up? How did you get together?
We were introduced by a mutual friend, and Mark is one of the faculty at a national hypnosis conference or training program for health professionals. I just happened to be one of the health professionals who really wanted to learn, and he said, "Oh, Greg, you've got to meet this Mark guy." So,
you guys have some things in common,
yeah.
Right?
And so that was back in the mid-90s, and once we started talking, the conversation just never stopped. We had so many shared common interests about integrative medicine, our views about empowering the patient, the individual, to trigger their own self-healing resources. And that dialogue went on for years and years. Greg went off to Japan for a while to do some teaching. And when he came back, we said, we think it's time to put our ideas together in a book. And that's what led to this.
The interesting thing is that your approach is pretty revolutionary to a lot of docs, probably a lot of patients, and yet it's an approach that people are coming to you from the medical world now and saying, help us, right? You've got some secrets here, some answers that, and of course you don't want them to be secrets.
Exactly. So that's why we had to write this book. You know, day after day, you see people coming in with amazing stories of suffering, and you have these amazing stories of recovery. You know, it's just very heartwarming, inspirational stories. You say, now, why did someone have to wait 5, 7, 8 years to get better?
And as you said, people can feel almost imprisoned by their problems, can't they, with digestive problems?
Yes, not only is it a leading cause of missing work, it's a leading cause of missing life. And whether it's dating or just going out with dinner for friends or all these things which can really kind of constrain people's experience of life and really limit their capacity to have a joyful life.
Could you both list the most common digestive problems that we're talking about? It's a broad field here.
Well, what we talk about in the book is that, first of all, when someone rules out the more serious digestive disorders, cancers, inflammatory bowel disease, that sort of things, Crohn's and colitis, once that's been ruled out, there's still a vast, vast, vast proportion of the population who have sometimes very debilitating digestive problems, oftentimes known as irritable bowel syndrome, or
IBS.
People call it. It used to be called spastic colon or irritable colon. This also applies to people who have dyspepsia or have GERD or reflux, where other organic reasons have been ruled out. And part of what Greg refers to here is the fact that millions of people, once they've been scoped and scanned and had every test, and they still have the symptoms, have this profound sense of hopelessness and despair, saying, what else can be done? And
they've probably gone to many, many doctors.
They've gone to many, many specialists by the time that they come to Greg or come to me. And the message of our book is that there is much that can be done. There's a lot of good news here, that there is much that can be done, and that these conditions can be treated effectively.
So a couple others that I think I'm remembering right, diarrhea, kind of chronic diarrhea would be?
Oh, in fact, there's a whole long list of things, words that maybe polite dinner conversation wouldn't, but everything.
Most people are not watching during dinner. So.
Okay, yeah, so I mean, everything from bad breath despite good dental hygiene, to reflux, burping, belching, hiccuping, getting full very easily, bloating, cramping, diarrhea, constipation, gas.
Even incontinence, you said, could be classified in a broad way?
Yes.
One of the things I found interesting is that you said that up until recently, most doctors have been probably treating the symptom, not looking at the cause for digestive problems in general.
Right.
Can you talk a little bit more about
Sure.
that? Because that's a key.
It's standard practice first when someone has digestive distress, as I was saying before, to rule out the more serious organic conditions. So the cancers, inflammatory bowel disease, that sort of thing. If those things are found, there are treatments that can oftentimes be helpful. But many, many people, once they've gone through that, let's say there was no cancer found, no inflammatory process, but they still have the diarrhea, the constipation, the bloating, the pain, the exhaustion, the despair, and the hopelessness that go along with it.
Yeah, I bet exhaustion would fit in. I hadn't thought of that or hadn't registered
Sure.
that would.
And so many patients with these kinds of conditions are often told by well-meaning specialists that either there's nothing wrong with you, or we don't know what's wrong with you, or it's psychosomatic, it's all in your head, so learn to relax. And so they kind of fall in the cracks in between, it's a quote, real physical disorder or quote, real psychological disorder. And the reality is that our mind and body don't treat these things as if they're separate.
Well, you in fact said you view the gut, using your phrase or word, as the second brain. And that made me stop and think. So what does that mean? I'll let you feel that.
Well, we both have different approaches to this, and that's why it's kind of a good team. Mark being a health psychologist, me being a kind of a geeky internist. And when we think about the science of the gut, it includes the fact that there are more neurotransmitters in the gut than in the brain.
Now that would be a big surprise to most everybody, I think.
Yes.
Unless you're a neurologist or
well, it's part of why we like this title, Trust Your Gut, because in some sense, there is a wisdom that comes from gut sense. And it's been present in every culture of the world, has language along this line. But if you suffer from gut distress issues, then you can't really access that intuitive wisdom. It blocks it. In fact, you no longer trust your own body, you no longer trust your own self.
So you want to be out of your body, kind of, or you're trying to escape.
Yeah, somehow, if your body is keeping you from living life. And so the idea about a second brain is that, there are many parallels to our actual brain. still the central control centers are up here, but there are little localized control centers in the gut. And there's bidirectional communication all the time. Anyone who's experienced hunger, anyone who's experienced nausea knows that it's not one location, it's a whole body experience.
Another piece to build on what Greg's saying is that I think one of the core concepts that drew us together in our interest in writing together is this belief that people possess inherent internal self-healing resources if they can access them. The other thing that we need to remember is that our brain perceives pain as a threat. And so when people experience discomfort, the normal reaction is to tighten around it, resist it, do something to get rid of it. And
breathe from the upper part of the chest.
Sure, constricted in how they breathe. Exactly. And because they become then instinctively afraid of the sensations in their body, what they do not do is learn how to actually sit with the sensations and then be able to derive some of the inherent wisdom that we believe is there.
You talk about listening to your body?
Right, right. The fact that actually once you know that it's safe, once you know that the alarm system that is turned on when you have distress is really a false alarm. Once we know that all the more serious diseases have been ruled out, then the sufferer can begin to learn that, oh, this alarm doesn't mean that there's actually something I need to be afraid of. Then they can start to sit with and listen to the sensations of their body differently. And when they do so, because of neuroplasticity, the ability of the brain to grow and change and develop new neurons, the person can actually learn to change their neurological response to the sensations in their gut.
Sort of having the mind control the body?
It's getting the mind and the body to work in better cooperation.
Okay, because I know we don't want to think of one being stronger than the other, but
right. It's about learning to work together.
It almost sounds like it would be mind controlling, but
well, it's really the mind learning to
partnering,
listening to the sensations, being aware of the sensations in the body, and accepting them and integrating them rather than fighting them and trying to resist them.
There are so many ideas that I want to pick your brain on, and I think you're getting some of the basics here. I'll hold up the book later so you can really get a good look at it, and perhaps you're going to want to read it to get all the depth from it. But I want to jump into some real specific questions that I found just fascinating, and I think my viewers will too. One was tied into the centering and to the supplements that we can take, and everybody can benefit from these. And there were 5. And one was vitamin D, and I know you both have done extensive work on vitamin D, a multivitamin, probiotics. But would you just list the 5 and briefly list the sort of best number we should aim for in terms of milligrams?
Okay, all right, here goes.
Get out your pen and paper.
Yes, well, number 1 absolutely is vitamin D. Absolutely, for every Minnesotan, everyone watching this, vitamin D is absolutely. Now, dose does not matter, or dose doesn't count. What counts is what the blood measurement is. But I would recommend at least 1,000 international units a day for adults.
For most people.
Yes. The bigger one is, the more one needs. Okay, but really counts as a blood level. You want a level between 40 and 60.
And you can get that with a simple blood test.
A simple blood test. Okay.
You may need to ask your physician though, right? I mean, they don't just do it routinely, do they all the time?
Well, it depends where you go.
Okay.
But you can also,
maybe.
yes, but you can also purchase vitamin D blood testing here in town without a physician's requirement. I think it's $45 at Nutrition City.
So then you can up your intake if you need to.
Yes. So number 2 would be a multivitamin, but a good multivitamin, one without, you want to make sure you're getting good vitamin E. If you see the vitamin E in a multivitamin is D, L, alpha tocopherol, that means don't like.
That's
Okay.
an easy way to keep it in our minds,
Okay.
right?
Yes.
So
So many
Look at another brand.
Yes. You want to get D, and then if you get alpha, beta, delta, and gamma tocopherol and tocotrienols, even better. It's complicated, but vitamin E is not a single thing. And so you want to make sure a good multivitamin is one that's absorbed and treats your stomach nicely. Number 3 is magnesium. Absorbable magnesium that comes as threonate, glycinate, taurate, malate, citrate. For constipation, magnesium oxide is fantastic. 400 milligrams a day for constipation is that's the first stop. Of Walgreens, you get a 6-month supply for less than 5 cents a day. It's a great place to go. Number 4 would be, fish oil.
Oh, right.
And
You
so
said 1,000 milligrams.
of EPA and DHA. And number 5 are probiotics. Probiotics are friendly bacteria. These are beneficial bacteria, and in fact, play a very important role in when we talk about the gut being a garden and not a gutter. Gut is not a gutter, it's a garden. Our mission is to be good gardeners, and that means good seeds, good soil, and good support. Probiotics are the seeds.
I think a lot of people think probiotics are kind of an alternative thing. They're not thinking of it as a mainstay supplement, but it should be.
It's at the point now where it's really well established, and there's strong empirical support for the importance of the probiotics.
Another specific question, thank you, this is very helpful. Stress and cortisol and body fat or belly fat.
Mm-hmm.
Tell us just
Well,
briefly about that. That
sure.
was interesting.
Yeah.
Because I think a lot of people have belly fat.
Well, there's a number of interesting connections there. First of all, you can't stress enough, no pun intended, the notion that people look at these disorders that, whether it's physical or psychological, and these are really a combination of both. And when people encounter stress, which we define as the perception that one's capacity to cope has been exceeded, at that point, the brain responds as if there is a threat. Again, pain is perceived as a threat. It releases stress hormones, which eventually turn into hormones such as cortisol. Cortisol, among other effects, can increase belly fat. Cortisol also tightens muscles. Cortisol also leads to a sense of tension and anxiety. And
Not good for the heart.
not good
Too
for the
much.
heart. And when you have painful sensations, stress hormones like cortisol also change nerve transmission and heighten the perception of pain. So again, what we see in these studies with patients who have IBS is that they'll respond to a minor sensation with a greater level of perceived pain because of the stress. So when we
That's
say
very
that
interesting.
when we say that addressing stress is important, it's not because it's all in your head. It's because our brains respond to stress with true physiological responses. Learning to control those and respond differently help the gut feel better.
So Hans Seeley, the father of stress, I mean, he had it right, didn't he?
He was really onto
way
something
back there.
with those poor rats who that he stressed tremendously. And in an autopsy, they found that their thymus, which is one place where T cells that help immunity, was shrunken, and then it had tremendous other effects on depleting the body. So stress is a physiological as well as psychological phenomenon, and it affects the gut tremendously.
And that's fairly new information for the lay public, for me, for most people, I think. We don't always think of those two together. You also talked, and I found this very interesting, pharmaceutical stress. If a person is on long-term antibiotics or chemo or other kinds of meds that are ongoing, you can have some real. And do you want to define pharmaceutical stress?
Well, actually, it's part of what we call the 5 forms of stress: environmental, physical, emotional, pharmaceutical, and dietary. Pharmaceutical can include antibiotics, just 1 week's worth of amoxicillin demonstrably changes the gut bacterial ecology a year later.
It lasts that long?
It lasts that long.
My gosh.
And so think about proton pump inhibitors like omeprazole, Prilosec, and the like, and it affects the gut. Prednisone and all this steroids, much less chemotherapy and other things. And so it's one form of stress that limits the body's capacity to be its best.
So if a person listening is saying, wow, I'm on one of these medications, are probiotics the way to deal with it, or are there other things that...
Well, it's a combination of things. Certainly probiotics may be part of it, but we talk about all, as Greg said, there's 5 different forms of stress, and part of what we encourage readers to do in the book is there are questions to help the readers see where do they fall on all of these different levels of stress, so that there are strategies you can do about environmental stress, about dietary stress, about pharmaceutical stress.
So you look at the whole person, don't you?
Absolutely, because that's what the brain does. The brain does not distinguish between physical and psychological. And there are things that readers can do that we talk about in the book that are very specific, very simple, and that with time will help correct those imbalances in the stresses, be they pharmaceutical, dietary, environmental, or emotional. So it puts them in better balance and helps their gut to heal.
Very interesting. We have 5 minutes left. I'm going to just give you some rapid fire questions. Sleep and high protein meals. We should really avoid them, right? At night.
Timing of meals is very important, and a high protein dinner at 10:30 at night is probably not a good way.
As the Europeans do.
Well, yes, but they might counterbalance with maybe a siesta in the afternoon.
True.
So
get your protein in earlier is important.
Yeah, yes, and there's been data to support at least 11 hours of fasting per day as being helpful for overall health.
Really? Just explain that, Greg. What you mean not eating for, oh, I see. So over the night and then 3 hours prior, stay away from food. Okay, no bedtime snack then?
Well, the thought about, consideration about sleep also is that people sometimes forget that sleep is when the immune system is much more active in terms of repair, tissue and cell repair, fighting viruses and bacteria. So things that interfere with sleep also interfere with gut health. And so again, part of what we talk about in the book are ways to assess your sleep, assess things that interfere with the sleep, and things that you can do to improve it, which then also affect the digestion.
When I first started reading the book and I read that the gut is affected to the immune system, I thought, no, wait, now how does this work? But it's really via sleep primarily?
Well, sleep is one of the pathways, but again, not only, as Greg was saying before, 95% of the receptors for many of the neurotransmitters we think of being in the brain are in the gut. Many of the immune messenger molecules, cytokines and that sort of things are based in the gut as well. And so the health of the gut, the health of the garden, has a tremendous impact also on one's immunity. And there's a beneficial snowball effect. When you watch stress is better, when your diet's better, when you're taking better care of the 5 forms of stress, you're going to find also that your immunity improves and you become more resilient as well.
We're certainly all tuned into immunity strengthening as much as possible, especially in this long, cold winter. We're taping in January on probably the coldest night of the last 10 years. Well, we want to give folks a way to learn more, because I apologize in a way, I'm jumping around, but I'm kind of following my intuitive question, curiosity here tonight. The book is called Trust Your Gut, and I'm going to hold it up, and then we're going to give you a website so that you can go to the website and learn more about how to get the book. It's so readable. I told you earlier that I sat down and read it in a couple of days and just learned so much and found it understandable, not too medicalese. And so here's what it looks like, Trust Your Gut. Let's put the websites up now. We have 3 websites for you. First, trustyourgut.com. You can learn about the book. And then Dr. Weisberg's website, drmarkweisberg.com, and Dr. Plotnikoff's website, gregoryplotnikoff.com. So they can at least track and learn much more about the topic that I hope we've piqued your interest. Well, is there one last thing you'd either one like to say to viewers who are maybe sitting there thinking, yeah, I'm realizing some of what you're saying. I want to be left with one go-to message?
There is hope. That's really what Mark and I really want to convey. It's kind of, we see so many people who feel hopeless. We say, no, 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 no. The latest science of the gut, latest science of the mind-body-gut connection all tells us, and immense number of stories, happy stories, inspirational stories in the book tell us there is hope.
So don't just keep suffering and think, well,
Yes.
runs in the family, or I've dealt with it for years, there's
Yes.
nothing I can do.
And I would add that research on the kinds of concepts that Greg and I are talking about are now starting to get more attention.
Yes.
And so it's much more likely now that the chronic sufferer who has been feeling hopeless and powerless, better chance now that when they go to a major medical center to get some help, some of these concepts are now starting to be a little bit better known. So again, to reinforce Greg's message, hope is possible, no matter how long you've suffered.
We couldn't end on a much more powerful note than that, could we? Thank you both so much for coming down and as I said, piquing our interest and helping us learn more about this important part of our body. Thank you for watching. I hope you can check out the book. I'll see you next week. Bye-bye.